Well, we're all learning a lot on the run, and we'll address every challenge and carry on with a sunny disposition. Look, this is an unprecedented time.
But that's where schools have to make that difficult decision. Do they have the capacity as a community to run e-learning, or do they just have to close their doors and not run e-learning?
Indiana announcing new steps in the fight to stop the coronavirus outbreak. Today, the governor ordering schools to stay closed until at least May 1st and said school might not start again until the fall.
He's also delaying the state's tax filing deadline and any tax payments to July 15th. The state is also blocking all new foreclosures and evictions during the health emergency. We have full team coverage on all of this tonight. Let's start with David Williams about new words about the virus and the virus testing in Indiana. David.
These are the executive orders the governor signed today. His message to you: we will get through this.
I know we can't control everything, but we can, as Hoosiers, control our individual behavior and our own actions. And that means practicing good social distancing. That means washing your hands again and again and again.
For your health, the governor's new actions include a request that insurers hold off on canceling a policy for 60 days because of non-payment, asking health insurers to cover COVID-19 testing without prior authorization and not raise prices or coverage costs of COVID-19 medical care.
And we have to go on offense to slow the spread.
Today, State Health Commissioner Dr. Chris Box said more test kits are on the way.
And that most individuals with mild symptoms do not need to be tested. Even with expanded testing options, we still have a shortage of supplies, and we need to be mindful of that. As testing increases, we expect to see our number of positive cases grow.
If hospitals are short on supplies like gowns and masks, Dr. Box says the state will know immediately and will help in any way possible. I asked Dr. Box about drive-through COVID-19 testing in central Indiana.
I personally see a role for a clinic or an area where individuals can be tested that need to be tested but maybe do not need to be in the emergency room. I do not see a need to test the young, basically healthy person or even children that have these symptoms, because that is not the population that we want to expend all of our resources.
Dr. Box says the focus is on the highest risk patients, like people who are in the hospital, healthcare workers, and people who live and work in long-term care facilities. You can find more right now on wishtv.com. For now, we're live in the State House. I'm David Williams, Wish TV, News 8.
Good information, David. Thank you very much.
All right, let's bring in News 8's Julia Dang now. Julia, tell us more about those changes for Indiana schools.
Well, Brooke, covering the impact of this pandemic, there are many unknowns, but the state's top education official made it clear she believes it is a good idea to keep schools closed until May 1st at the earliest. During the governor's briefing here this afternoon, we heard from Jennifer McCormick, that's Indiana's superintendent of public instruction. She vowed to ensure high school seniors still graduate on time, but other aspects of education are facing unprecedented disruption. State testing is being canceled, including iRead 3 for third graders, iRead 3 retesting, iLearn for grades 3 through 8, IAM, WIDA, iSprout, and iSTEP for 10th graders, which was already in progress. E-learning is now the preferred alternative, but only about half of Indiana public school districts have enough devices for each child to take one home. And McCormick admitted not all of those devices are even optimal for e-learning.
Diligently working on how to get devices home other than a phone, because when you ask families, are you connected, and they say yes, and it's a single phone, it's difficult to run e-learning on a single phone. So we're looking at access. We've worked with some partners. We've sent out free resources. There is a gap, and I'm not going to pretend that there's not one, but that's where schools have to make that difficult decision. Do they have the capacity as a community to run e-learning, or do they just have to close their doors and not run e-learning?
Holcomb adding during that briefing it would be a miracle if schools opened before the end of the 2019-2020 academic year. Indiana does require districts to have 180 instructional days each year. Last week, the state approved a 20-day waiver, and that would have helped districts that couldn't take advantage of those e-learning days. McCormick now indicating that waiver could be extended. Reporting live, Julia Dang, Wish TV, News 8.
Julia, thank you. Well, there will be no boys basketball state champion this year. Late this afternoon, the IHSAA officially canceled the tournament. The State Athletic Association postponed the games last week, but had hoped to reschedule them. Officials say the cancellation is for the health and safety of the public.
Governor Eric Holcomb says we should expect changes for Indiana's primary. It's scheduled for May 5th, but that date could change.
Out of first concern for our county officials that have to conduct these elections, our poll workers and voters themselves. And now the details have to be worked out, and the Secretary of State is running point on that. But I'll support ultimately the decision to postpone our primary election.
Holcomb went on to say that he plans to meet with Indiana's Secretary of State and that an announcement could come later this week.
Well, state health officials added 17 more cases of the coronavirus, bringing the total to 56. 187 people were tested from yesterday to today. That is the biggest jump since the first case was identified in Indiana. The state is still reporting 2 deaths, but state leaders say to expect that number to rise as well.
Now, as far as the impact the coronavirus is having on the economy, we talked with Indiana Senator Todd Young about another potential stimulus package.
But the real focal point of this next line of effort is going to be to make sure that we properly capitalize businesses that, through no fault of their own, through no bad management decisions, suddenly hit a wall with this pandemic virus and need sufficient capital, in particular to make payroll, but obviously to meet other obligations as well.
President signed a $100 billion virus stimulus response bill last night. His Treasury Secretary says a new stimulus package could include payments of up to $3,000 to American families. Well, police in Boone County now investigating death threats made against a member of the health department.
And they tell us the threats are directly related to the coronavirus pandemic. Here's IT Mate's Richard Essex.
Ann DiCarlo is a volunteer with the Medical Reserve Corps. She screened everyone coming into the Boone County Courthouse this afternoon. The county is under a state of emergency that requires anyone entering a public building to be screened for the COVID-19 virus. Most everyone has been accepting the new normal with a few exceptions.
I had received 2 death threats due to the closings of due to coronavirus.
Brett Pepin is the county's environmental health director. The threats were both delivered to him on Monday.
One of them was pretty vulgar. They stated they knew where I lived and indicated that in their email that they had. They certainly were very vicious in that attack towards me and my family, singling out my wife and my child as well. Certainly unacceptable things during these times. We're all doing what we can to protect the best interest of the public.
The Whitestown police are investigating the first threat. They say the investigation is ongoing and they're not at liberty to release any information. The second threat was investigated by the Lebanon police.
People are stressed right now. People are nervous and scared and maybe a little more on edge than what they would be normally, but we do see these threats all the time and we take them all seriously.
The threat originated from the closing of a public building and a person not having access to the public Wi-Fi. This week, access to many public buildings in Boone County have been drastically restricted. The county commissioners ordered a state of emergency which closed most public buildings to the public. Buildings like the courthouse require a quick screening to gain access. Lebanon police say the second threat was resolved without an arrest. In Boone County, Richard Essex, Wish TV, News 8.
Richard, thank you. Well, Carmel's mayor wants city residents to stay home and keep unnecessary traffic off the streets.
He issued a new order limiting traffic. News 8's Aaliyah Hodges spoke with him this afternoon. She joined us live in downtown Carmel. Aaliyah.
Well, this order took effect last night. The city is asking for people to only leave the house for essential needs for the next 7 days. And although this new order is affecting the local economy, a lot of people that I've spoken with are in favor of it. Downtown Carmel is a ghost town. Mayor Jim Brainerd has ordered that people only travel for food, shop for essential needs, medical reasons, and mandatory work.
I think it's necessary maybe to kind of, force people to take it a little bit more seriously maybe than what they normally would be.
The order has many people wondering how it will be enforced.
I just ran by a police officer. He didn't say a word to me.
This order gives officers an additional tool to use if necessary, but we're calling on people to do the right thing.
The mayor has also shut down public playgrounds but left open nearby walking trails.
To me, you might be sending a mixed message where they've closed the city playgrounds, but yet you're still free to kind of come out and use them on. They're wanting to, you would encourage to get outside and enjoy, the air and, all that. So, but that kind of goes against, I guess, the whole social distancing. Obviously, if there's, a ton of people out here walking.
The community hopes this mandated order will prevent even more restrictions over the next few weeks.
We're working with all sorts of businesses. We understand there's a huge impact on business, but we believe if we take more drastic steps now, it will shorten the length of impact on our small business community.
Now, the mayor did tell me there are quite a few people being quarantined right now. They are carefully being looked at here in the city. However, there has been no confirmed cases related to the coronavirus here in Carmel. I'm Aaliyah Hodges, News 8.
Leah, thank you very much. We're following up from our Coping with Coronavirus special last night. There was an overwhelming response from our viewers, and we're continuing that discussion now. News 8's medical reporter, Dr. Mary Gillis, joining us now. Good to see you, Mary. Thank you for being here once again. So one of the questions from our viewers last night was, can coronavirus live on surfaces such as clothing and sheets? And if so, what can we do?
So, yes, the answer is yes. We are we think of these hard surfaces like this chair I'm sitting in or this table that is over there. But, clothing, we wear clothes every day. We use towels every day. We sleep in our beds every day. And according to Dr. Virginia Kane, the director of the Marion County Public Health Department, she says, yes, it can live on our clothes for 2 to 3 days. And what happens is, we sneeze, according to CDC recommendations, into our elbow, but those droplets get on our clothing. So what can we do about it? Well, Dr. Kane says when you get home, take off your clothes, put them in the wash, then get into nice clean clothes. Make certain you're washing your towels often, washing your bed sheets often, and make certain you have a detergent that has Clorox in it.
Makes a lot of sense. We've also had several viewers ask about medication. The CDC recommends that you have at least 1 month's worth, but the situation, we've never seen anything like it. It could extend past 1 month. What should folks know?
So, across the panel, this was the recommendation. So what you want to do to limit your time to going to a pharmacy to practice social distancing is to try and get a 3-month supply of your medication. And basically, the recommendation is to talk to your healthcare provider. The healthcare provider will then talk to your insurance company. And during this time of need, they will certainly, accommodate.
Yeah. Okay. All right, Mary, good conversation. And you mentioned social distancing. That's why we're so far apart. Good to see you. Thank you.